This is Beverly Thomassian, and I'm going to be reviewing today CDCES or BC-ADM, which certification is right for me. This webinar was put together by popular demand because so many people were reaching out to us and saying, what's the difference? Which one's better? Which one's better for me? And I have both certifications and I've had them for a long time. So I have a lot of personal experience with it. And I also have a lot of professional experience with it because I talk about it a lot. So we'll be diving into more details as we go through. This is a picture of our new online university. We have over 50 online courses that we've just migrated to a new platform that is a lot more intuitive and easy to use. So I hope you have a chance to look around and view our courses. This is our website, just to kind of orient you to it. This is where we have our free CDCES coach app you can download for your iPhone or Android. Here's where we have our free medication pocket cards, and they look like this. You can order them, a laminated 8-sided card, which is fantastic, or you can see our pocket card on our app for free at any time, or you can download it, have a copy of it, a paper copy, or what I do is when I'm working in my office, I just have it up on my second screen along with my other medication cheat sheets. This tab is amazing, free resources, because we have all kinds of free cheat sheets, we have free webinars. I mean, we just try to infuse our website with a library of information. And if I think the article is really helpful, it's going to go on our website because I want to share it with you all. Here's where you can purchase books and study tools, courses for our online university. Here's where you log in. So that's what our online university looks like. And today I will be talking about CDCES versus BC-ADM. But if you want to really get down to the nitty-gritty and just dive into an hour and a half of content, it's about an hour and 15 minutes. We are offering a CDCES webinar January 31st and February 20th for BC-ADM. And I go over a lot of sample practice test questions during those webinars and give a lot of test taking hints. Now, if you aren't able to attend that live or that date doesn't work for you, I offer both of those throughout the year. And you can always just go to our free resources page and click on CDCES or BC-ADM and listen to the recorded version. So we try and make sure it's either coming up live or recorded so you can take advantage of that content. These are the books I'll be talking about. This is the desk reference, 800 pages of intense information. Like it's kind of this resource you'll have forever on your desk, on your shelf as a diabetes specialist. And this is preparation for the exam, 480 practice sample questions with the rationale. So regardless of which exam you're taking, this review guide is so helpful just to get you more comfortable with test taking. Now, our company is dedicated to service, and we love our community. We love what you do. We love that you're here. So we want to help out. And we have Brianna. She is our director of operations and customer happiness. She knows our company like the back of her hand. So she can answer 99.9% of your questions. And if there's ever something that's kind of new, we'll definitely discuss it. Or if you need to get a hold of me, Brianna will make that happen. So you can chat her, you can email her, you can phone her. She's just a wonderful person to connect with. So that's kind of an introduction. And then let's talk about what this webinar is all about. We'll look at the roadmap to becoming a CDCES or BC-ADM. We'll look at about 3 or more differences between the credentials, and we'll discuss the benefits and drawbacks of each certification. Now, I just thought I'd share my journey because it just gives some insights into, how I got to where I'm at. So I'm a registered nurse and I have my master's in public health. I graduated with my master's in 1990 from UCLA. So I'm not an MSN, I'm not a nurse practitioner. So that's kind of interesting. But I was able and, am able to pursue my certifications with my degrees and my master's degree. So in 1992, I passed my CDCES exam and I became a health education manager at a HMO. So I really wore my health education hat and infused that with my clinical experience. And I did that for 4 years. And I oversaw a team of health educators, and I also provided classes for our members. In 1994, then, I was hired as a diabetes nurse specialist at Stanford Hospital. Okay, that's a big leap. So I went from doing outpatient health education to inpatient intensive management at a very advanced level. And I just was thinking about this the other day. Since I don't have my master's in nursing, you know, where did I get all this additional diabetes information? And I'll just say to you, I just got it from self-study. Like, I reviewed that big desk reference, and I read a lot of articles, and I read the standards of care. And of course, just working with people with diabetes is very instructive. So you see people with diabetes in all these different situations, you ask them questions, you see how their body responds. And I think for a lot of us, diabetes is really on-the-job training. So wherever you are, it's okay. And I think we just keep gaining knowledge as we move through our profession, whatever profession that is. And that on-the-job training is the most important. And both of these exams really want to make sure you have a mastery level knowledge of the information. Mastery level doesn't just come from a book. Mastery level comes from experiential learning. And so that's the path we're on. There's yeah, lots of ways to get there. Okay, 1998, I started my own consulting company, Diabetes Education Services. So when I started my company, of course, I had to keep expanding my knowledge, you know, being really on top of all the new information that's coming out so I could translate that and share it with you. But also concurrently, I ran the diabetes program at a local hospital, Feather River Hospital. So I set up their ADA recognized program. I also wrote and updated all their policies for the inpatient side, and then we were doing quality assurance measurement to see how our blood sugars are doing on the inpatient side, in addition to running an outpatient program. So I wore lots of different hats in that job, and you know, it's been exciting because I think as a diabetes specialist, there's so many different ways you can provide care, in so many different ways you can make a difference in outcomes. And that's what I truly love about our profession and our community, because we're very collaborative and we love information sharing, and we can help people on a population basis, and we can also help that individual that's sitting right across from us. So I love it. Now you might be wondering what happened next. I am too. Let's see what happened. In 2001, I passed the BC-ADM exam. So I've been a BC-ADM for a long time. And just currently, I work at an Indian Health Services clinic, and I work there 1 day a week, and I see people who are sometimes disenfranchised, people who are from different countries who have moved here, who are just learning the language, but they're working hard and they really want to participate in their health. And so I am committed while running my company to always working in the clinical setting. So I am familiar with what's happening and what the different issues are that affect people with diabetes. So how do I maintain my certification? Well, for my CDCES, I take the exam every 5 years. Now, why would a human do that? Well, I do that so I can be familiar with what's on the exam, but you don't need to do that. You could choose to renew your certification by taking the exam every 5 years, or you could renew it through CEs. I've passed the exam 7 times. I can't believe that I can't believe I've taken it that many times. I completed it for the 7th time last year, or earlier this year in 2022, about 6 months ago. Okay, BC-ADM exam. I sat for the exam twice, starting in 2001. I passed it the first time, but I want to be honest with you, I did not pass it with flying colors. I mean, I kind of squeaked by, and because I had mostly done inpatient work most recently, and I hadn't really assimilated a lot of knowledge about outpatient work, and I wasn't that familiar with pharmacology for cardiovascular disease. So the BC-ADM was challenging to me in that it really required big knowledge on pharmacology of not only cardiovascular disease, but also thyroid disease and other co-conditions associated with diabetes. So it really identified for me an area I wasn't that knowledgeable in, and I had some knowledge gaps. And actually, taking that exam improved my care, because when you realize you have knowledge gaps, you fill them in, right? You want to seek that knowledge so that you don't have blind spots when serving people with diabetes. So I want to say just one other thing is, A lot of you listening today, whether or not you have these certifications, are doing advanced level work. You are a master in diabetes. I know that because, before I got my certifications too, I had this extensive degree of knowledge and mastery, but yet I hadn't attained that CDCES or BC-ADM. So, our knowledge transcends these certifications. So I want to say that out loud. Yes, these certifications do say, okay, to your colleagues and to others, that we do have this specialized mastery of knowledge. So it is affirmational in that way. But, I know that you all are practicing in a variety of settings and doing excellent care and advanced level care many times. All right, so how do you renew your BC-ADM? You renew it every 5 years. So I sat for the exam twice, and then after the second time I took the exam, they go, you have to give back. So this is interesting because it's like they want us to provide mentorship for the next generation of diabetes specialists. They want us to be leaders in the field of diabetes. So to renew, you need to do CE activities, do academic credits, presentation, publications, mentoring, professional service. Okay, so there's a lot of different things. And, there's work involved in that. So that's the difference between renewal for the two. Oh, here's my recent roles. I wasn't sure if I had this slide in there. I couldn't remember. So as I've mentioned, I worked in the hospital setting. And, when I think about what cap was I wearing, was I more of a BC-ADM or CDCES when I was working on the inpatient side? You're a consultant. And as a consultant, we might be focusing more on education, or we might be focusing more on advanced level practice, like improving systems and identifying different research that can be done, or quality assurance programs that can be implemented to improve care and improve outcomes. So many times there's a blending, right, of these different roles that we do. In the clinic I'm serving right now, I would say I wear more of my BC-ADM cap. I'm more of a consultant to provider. I'm very involved in medication change for not only diabetes, but for cardiovascular disease and other co-conditions this person might present with. I'm going to request that we order different labs and definitely focus on mental health issues. But I see my role in my clinic setting currently more advanced level because I'm not doing education classes. I'm doing individual education to people with diabetes, plus collaborating with the nurse practitioners and providers at the clinic. But I do want to start a support group. I do a lot of case management. I do a lot of medication adjustments. Now, when I say I do medication adjustments, let me clarify. I have no prescriptive authority. I'm a registered nurse. My master's is in public health, so I'm not a nurse practitioner. So when I say that, I make recommendations to my colleagues for these medication adjustments, and many times they say go ahead and input it into the computer. So once I get the approval, I input it and get that going. So some of you might have prescriptive authority and you can make that decision on your own, which is awesome. Okay, BC-ADM versus CDCES question. What best describes the difference between a certified diabetes care and education specialist and a person board certified in advanced diabetes management? A, BC-ADMs are responsible for increased complexity of decision making. B, a bachelor's degree or higher is required to obtain a CDCES. C, the main difference is that BC-ADMs prescribe medications based on diagnosis. D, with an advanced degree, BC-ADMs are qualified to set up an independent practice. So let me go ahead and launch that poll and see what you all say. Okay, we'll take a few more minutes. I meant to say seconds. Okay, I'm going to go ahead and, okay, thank you. I'm going to close the poll. Thanks for voting and share your results. So we had a tie. 50% of you said A, BC, ADMs are responsible for increased complexity in decision making, and the other half of you said you must have a bachelor's degree. Okay, so let me close this poll. All right. So actually, the best answer is A. BC-ADMs are responsible for increased complexity in decision making. That's kind of the differentiator. And that's not to say CDCES doesn't make complex decisions, but if you want to draw a line and kind of describe the difference between the two roles, there's an additional expectation that the BC-ADM will not only be able to manage diabetes, but co-conditions. So as far as a bachelor's degree for the CDCES, a bachelor's eligibility to take the exam is based on licensure, registration, or certification. So it's not based on having a bachelor's degree or greater. For example, there's many registered nurses without a bachelor's degree who have their CDCES. So here's a list of people who are qualified to take the CDCES exam. And the other thing is, as far as setting up an independent practice, it's not the BC-ADM that creates an opportunity to set up an independent practice. As a licensed nurse, for example, I can't set up an independent practice and bill for my services in my state, even though I have my BC-ADM. Certification does not change your ability. Your scope of certification doesn't change your scope of practice and can come from different organizations. Each state's licensure and scope of practice regulations come from a governmental authority. So we need to practice within the legal parameters of our scope of practice based on licensure. And I read that because I want to get the wording exactly right. So it really is by state basis based on your licensure. That's the most important thing to kind of keep in mind. So A is the best to answer. True or false questions. So I have a series of true or false questions I'm going to ask you. So just to kind of review or to wet your whistle for future content, CDCEs need 2,000 hours of diabetes self-management experience within 5 years to apply for the certification exam. Is that true or false? And we'll just do this real quick. Is that true or false? So you can just choose A or B. Just take a guess. All right, well, I'm going to close the poll and show you result. We had a tie again. That's kind of interesting. It's actually false. We need 1,000 hours of diabetes self-management experience within 5 years. Okay, just try another one. For CDCES or BC-ADM, certificates are required to renew certification by retaking the exam and completing the required CEs. Is that true or false? Okay, good job, guys. That is false. So you don't have to retake the exam every 5 years. You can renew by CEs for both of those. BC-ADM is renewed every 10 years by submitting proof of providing advanced level care. Is that true or false? What do you think? Okay, I'm going to close the poll and share the results. And 100% of you chose the best answer. That is false. It's every 5 years. So now that we've kind of piqued your interest, let's look at this very exciting chart. So BC-ADM versus CDCES eligibility. And you can see where I got this from, diabeteseducator.org. So this information, it was just on diabeteseducator.org, or that's our website for certified diabetes care and education specialists, our national website, and for BC-ADMs. So who is eligible? You can see here for BC-ADM, the eligibility is a little more constrained. Registered nurse, dietitian, pharmacist, PA, physician. Over here for the CDCES, there's more professions can really get the certification. So here's some standard pathways: registered nurse, dietitians, pharmacists, PAs, MDDO, many others. And then there's a unique qualifications pathway for additional for healthcare professionals with advanced degree and health-related concentrations. And so that would be, somebody like with a master's in public health, but they don't have the RN or the RD in addition to that. So they can certainly sit for the exam, but they're going to need more hours, and they would go through the unique qualifications pathway. Experience for the BC-ADM, 500 clinical practice hours within 48 months prior to taking the exam. For the CDCES, at least 2 years of experience working in their qualifying profession, and then 1,000 hours of diabetes education within 4 years. So that means you're providing diabetes self-management education. You need 1,000 hours with 400 hours completed in the preceding year. For the BC-ADM, that person needs to have an advanced degree, a master's degree or higher, as listed here. For CDCES, we realize that it's based on licensure, but they need 15 clock hours of diabetes-related continuing education within 2 years preceding the application. Of course, the unique qualifications pathway has different requirements, but that's kind of the basic comparison between professions, experience, and other requirements. Now, we do have packages where we bundle our different levels together to help people prepare for CDCES. We have a deluxe prep bundle, BC-ADM, and we also have a bundle that includes our library of content. The reason I'm bringing this up now is because all of our CEs count toward required hours for CDCES or BC-ADM, initial application or renewal. So we're accredited by the CDR. So the CDR is a national accrediting body on Commission on Dietetic Registration, which is recognized for both BC-ADM and CDCES CE hours. So kind of to summarize what I've said so far, when I think about the CDCES wears a cap, a coach's cap. The CDCES supports and educates people with prediabetes and diabetes to understand and self-manage their condition. They individualize treatment and behavior goals to optimize health outcomes. Now, the BC-ADM, on the other hand, has a white lab coat stethoscope, right? It's much more medically focused, physical assessment, hands-on. It's more pharmacology. It's management of co-conditions that requires at least a master's degree. We're not only helping with diabetes, but the comorbidities. And there's more complexity of decision-making. We're going to be more involved in research and mentoring and teaching college classes, for example. So those are activities that a BC-ADM would be expected to do. So just to clarify a little bit further, I'm going to dive first into what is a CDCES, and then we'll go over to BC-ADM. And I've already kind of given you the big picture overview, but now we're going to use the information from the handbooks, which really is specific about these two certifications. So a CDCES is a health professional who possesses comprehensive knowledge and experience in diabetes prevention, prediabetes, and management. The CDCES educates, supports, and advocates for people affected by diabetes, addressing diabetes through the lifespan. And both of these certifications really want us to know about managing diabetes from birth to death, inpatient, outpatient, and during pregnancy. So we have to have a lot of knowledge. The CDCES promotes self-management to achieve individualized behavioral and treatment goals to help that person get to their best health and reduce risk. CDCES is considered mastery level. Both of these are actually. It's a practice-based certification. So it's not just you can read a book and take the exam. You need to acquire 1,000 hours of experience providing DSME to take the certification exam. Would they understand that the practice is necessary to master the knowledge? And if you look at the test questions for the CDCES, very focused on giving you vignettes. So these vignettes put you in the seat across from that person with diabetes and ask you, what would you do in this situation? So they really want to make sure in these exams that you have the knowledge to manage, to coach, to support behavior change, and you're familiar with the guidelines and standards. Really, it's all evidence-based practice. CDCES provides formal recognition of specialty practice and mastery of knowledge. And I love this last bullet point. This is right from the application book, by the way. Provides validation of demonstrated dedication to diabetes care. Validation of dedication. I love that. What are the components of diabetes care and education? I was saying you need to get 1,000 hours of providing diabetes self-management education. So what exactly does that mean? Well, it includes the assessment where you sit down from that person and you hear their story, their diabetes story, what's happening. And then you collaborate with them to develop a care and education plan based on that assessment. You're going to say, what would you like to work on? What's important to you? Let's develop a plan based on that. And I'm going to, share with you my ideas too. Let's see if we can't support you to moving to better health. And then we provide ongoing support and we collaborate and refer as needed. We monitor their progress. So we're going to have them back. Maybe we do a telephone call or we do a support group or we have them back for a future appointment or classes. And to evaluate, we share what we're assessing with their referring provider. And then, of course, documentation is critical. And of course, then on top of all of that, we have to have a plan, right? How are we providing this care? How are we measuring our outcomes? How do we know that what we're doing is working? We have to evaluate that our program is effective. And if there's certain things that are falling through the cracks, we have to do a quality assessment plan to figure out how we're going to fix that. So these are different things that a person who's pursuing their CDCES will participate in. Self-management education, developing a program, managing a program, public health, surveillance, volunteer activities, diabetes-related research. If you're working in industry and you have a clinical role, those hours can count. You're doing case management, professional education, and you're a consultant. And you're providing information on diabetes. So those are considered professional practice hours that you can count. So let me ask you another poll question, and I'm kind of blending the CDCES and BC-ADM exams. I'm asking you for their philosophy. Which of the following are philosophies of the certification exam? And there's more than one right answer. A, motivate people to make lifestyle changes. B, empower individuals to improve diabetes self-management. C, consider the individual's needs, goals, and life experience. D, help all people with diabetes achieve an A1C less than 7%. E, collaborate and provide ongoing care. All right, I'm going to launch this poll and see which ones you think would be included in the exam philosophies. And more than one answer is correct. Okay, great job. I'm going to go ahead and close the poll and share your result. And 100% of you said B, empower individuals. B is absolutely right. Nobody chose A. A is motivate people to make lifestyle changes. As you know, that motivation has to come from within. So we can't actually motivate a person. I wish we could. I really want to. But just like you, nobody is making you come today, right, to this webinar. It's coming from you. So we have to find that fire within the person and help light that fire so that they can feel confident that they can achieve success with lifestyle changes. So A isn't right. A is not the best answer. And during the exam, we want to really keep focus on person-centered care. That's going to be true for both examinations. B is absolutely correct. We want to empower individuals. We want to help them realize they have it in them to make these changes to improve their health, and we believe in them. We definitely want to do C. C is going to be a big part of either exam. Consider that individual's needs, goals, and life experience. Even when we're doing medication adjustments or medication additions, or we're talking about different therapies that we think the person would benefit from, it's not about, telling the person you're going to do this. It's about checking in with them and making sure it matches and that they're willing to do it. It also is E. collaborate and provide ongoing care. So we realize we can't do this on our own. We're going to reach out to our colleagues and refer people to a dietitian, to a pharmacist, to physical therapy, occupational therapy, social work, providers, specialists, all those different wonderful co-collaborators who can help that person with diabetes get the care that they need and the outcomes that they need. So when you look at the exams, there's a really important thing they do is that they go, okay, what's within your scope of practice? And then where would you need to refer out to get more help? So they want us to have a clear understanding of where that line is. Okay, so we had our coach's cap on. Now we're putting on our white lab coat to talk about what is a BC-ADM. So a BC-ADM, and you can see it's really hard to put a black and white line in between these, right? There's a lot of overlap, but for the exam philosophy, I'm just trying to get you in the head of the examination. Skillfully manages complex patient needs and assists that person with therapeutic problem solving. Within their scope of practice, again, scope of practice is number one. The BC-ADM is, that mastery level certification, advanced level certification, but we always have to kind of think about our scope. Adjust medications if you have prescriptive authority. Treat and monitor acute and chronic complications. Counsel patients on lifestyle modifications. Address psychosocial issues. Participate in research and mentoring. And I love this definition. This is an old definition from the CDCES website. The depth of knowledge and competence in advanced clinical practice and diabetes skills affords an increased complexity of decision-making, which contributes to better patient care. So just that additional knowledge, experience, we can really put all these different pieces together and get that, aha, this is what that person needs, or, oh, this is what's happening, beyond just diabetes alone. BC-ADM provides opportunities for healthcare professionals to expand their roles beyond traditional boundaries and to demonstrate their effectiveness in performing at an advanced level of practice. Yes. So, right, instead of being boxed in and limited in what we can do, we can be more expansive in our thinking and say, gosh, this system isn't working at this clinic. Let's make some changes. Let's evaluate if that improves outcomes. Let's look at the person's flow. Are we really being inclusive and, providing care to all people in a way that that person feels welcome? And of course, this is not limited to the BC-ADM. A CDCES could do this too, but there's more of an expectation that the BC-ADM will be a leader as far as making changes to enhance and improve the care we provide, looking at social determinants of health and beyond. Advanced levels of activities. Management skills such as medication adjustment, nutrition therapy, exercise planning. Technology is going to be a big part of actually both roles. Counseling for behavior management and psychosocial issues. Attaining optimal metabolic targets, which includes treatment and monitoring of acute and chronic complications. Research and mentoring. Yes, and the other thing I'm thinking about a lot now is screening activities. So, do we need to have them evaluated for different conditions like thyroid disease or celiac disease? Do they have normal growth and development? If they don't, what labs would we recommend? With the BC-ADM, they would expect that person would know how to order labs, what labs to order, and when the labs come back, what that means. Like, would we know, what labs to order for celiac? And then if that comes back positive, to refer to the GI specialist. We would need to know what labs to order to evaluate thyroid disease and what that lab result means. We would need to be very familiar with the dosing and the different classes of medications for blood pressure, for lipids, for hypertriglyceridemia, for post, cardiac event. What would be the best medication choices for somebody with diabetes? So I would say it leans pretty heavily on pharmacology of diabetes and co-conditions, along with screening and testing. I just wanted to give you a shout out because we just updated our CDCES Coach app. Now, on our CDCES Coach app, we have the standards of care, we have all of our diabetes medication pocket cards, and under free resources, we have our cheat sheets And those cheat sheets have a lot of great information. I have cheat sheets on lipid medications, hypertensive medications, medications for nerve disease that you can just look at and download and have available for you at a glance. So much easier than Googling it. If you have an app, a pharmacology app, that is easy too. but these cheat sheets I've really designed for all of you to help prepare for exam and also for your clinical practice. I use it all the time in my clinical practice. That's under free resources or our cheat sheet page. But the exciting thing I wanted to tell you is we just updated the standards of care and we put in the 2023 standards of care. That's the American Diabetes Association standards, which for either exam, you want to know really well. So you could actually just go into that app, download the standards of care, and read it while you're hanging out. During the holidays, maybe you're hanging out and there's some quiet time, you could pull up standard 1 and just start browsing through that. Okay, let's do some true or false. CDCES is comprised. CDCES is comprised of 200 multiple choice and true and false questions. Well, that's true. I'm going to have to adjust this. So just so you all know, it's comprised of 200 multiple choice questions. There's no true and false questions on that. So I'm not sure how that snuck in there. So 200 multiple choice questions. Yes, that is true. BC-ADM is comprised of 175 multiple choice questions. Yes, that is true. Both essays require a brief essay of explanation at the end. That is false. So CDCES has 200 multiple choice, BC-ADM 175 multiple choice questions. There is no essay required. Okay, I'm glad we clarified that. So here is the table from diabeteseducator.org. BC-ADM, you get 3 hours and 30 minutes to answer 175 multiple choice questions. The CDCES is 200 and you get 4 hours to answer the question. So both of them, it's about a minute per question. So what you want to make sure is time yourself taking a computerized test if you can and see how much time do you take per question. Kind of knowing in the back of your mind a minute per question would be super helpful. The major content areas for BC-ADM is assessment and diagnosis, planning and intervention, evaluation and follow-up, leadership, and advanced professional practice. For CDCES, you can see it's a little bit different. Assessment, interventions, disease management. So that's kind of what we've been talking about. Now, how much do these exams cost? The BC-ADM is $600 if you're a member of the Association for Diabetes Care and Education Specialists, the ADCES. It's $900 if you're not a member. So it's cheaper to become a member and take the exam than to pay the $900. And I think being a member of the Association of Diabetes Care and Education Specialists definitely has its advantages. And there's a wonderful community that you can connect with and lots of resources that you can take advantage of. Now, for the BC-ADM, this is interesting. There's a June application. I mean, you take the exam in June, and the application is due May 1st. You can do it a little bit later, but you have to pay an extra $50. So you can take the exam either in June or December. If you're taking it in December, you need to get your application in by November 1st. So you can take it either in June or December. Now, the CDCES is different. It costs less, $350. You could submit the application at any time and take the exam at any time. So once you go online and apply to take the CDCES, you just have to choose a testing site or sign up to take it within 90 days. So once you get approved, you choose to take the exam. And for both of these, you can take the exam at home. It's called live remote proctoring, or you can take it at a testing site. So you have the option to do it either way. Now let's look at renewal. BC-ADM and CDCES, you renew every 5 years. You can see the BC-ADM is a little more pricey Again, being a member of ADCS knocks the price down substantially, $500 every 5 years. So that's $100 a year to maintain certification, where the CDCES is about $50 a year to maintain certification. So, this is another thing, is it's a financial investment, and who's going to be paying for this renewal? Is that going to be you, or is your employer going to cover the costs? So, these are just different things to consider. I think personally they are both worth it. It's a great investment in your professional career, and also it really lets your colleagues know your investment in diabetes care and management and education. So what do you do now? So you're thinking about CDCES or BC-ADM. You just want to consider creating a professional pathway for success. And there's a lot of overlap in the pathway. So if you're thinking about taking both exams, I would do them within a short period of time of taking one or the other, because the information you learn for one exam will help you in the other exam. So there is some overlap in the content. Diabetes specialists improve care for individuals and community. Do we get paid a lot more for getting certification? I don't really, I've never heard of somebody getting a, incredible pay raise when they get certified, but it is letting your employer know, your community know, your colleagues know that you're serious about diabetes care. And many times there is a pay increase for sure. But, this is not a type of certification where you're going to become a millionaire, but you are going to become a millionaire in your heart, because it's such a wonderful opportunity to connect so meaningfully with people living with diabetes. Seek out resources that can help you on your journey. And here, this is when I was teaching classes live, and I'm starting to teach classes live again. We have a 3-day diabetes education specialist course, and somebody was asking a question. So fun to start teaching live classes again. I can't wait to see all of you. So in conclusion, I just thought I would walk you through the pathway, a potential pathway to achieve certification. And, when we started our online university over 20 years ago, I just had a bunch of classes I offered. And then I realized I need to organize this in some way so people know where to start. So then we developed this level 1, and level 1 is just diabetes fundamentals. It's not basic at all. It's just the building blocks for the next level of courses, and we cover pathophysiology to medications to nutrition to activity to low blood sugar, high blood sugar, all of that. So that's our level 1, and you can see we're getting ready to record it starting January 10th. So every year I update all of my online classes so that it has the most recent information from the standards of care. And of course, it's great for my practice, right? Because then I'm like, oh, these are the new recommendations. I need to pass this on to the people I serve too. Level 2 is where I break down the ADA standards of care. So if you haven't read the standards of care yet, I would encourage you to do so. But sometimes as you're preparing for your exam by reading the standards of care, you might be thinking, gosh, what's most important? What should I study? What are the key areas? This is what these classes are designed for. I just break down the standards of care based on my knowledge, my clinical knowledge, and based on my experience taking the exams, highlighting what's the most critical content to be familiar with. And then level 3 is our boot camp. Our boot camp is a lot of fun because you can see it's starting in February through March. We just have 9 classes where we're working super hard. We do a lot of poll questions. There's a lot of test questions after each boot camp. Plus that last boot camp test taking coach session, I think there's 48 additional questions, test questions. So you are gonna be so buff by the time you're done. And when I say buff, like your test taking muscles are gonna be in the best shape ever. So you'll be really comfortable taking tests and knowing how to get to that best answer. Our level 4 courses are advanced level, but in addition, they cover content that's not in the standards of care, content that's kind of new, emerging, content that is important, but may not be on the exam. While some of it is on the exam, like the Solving Glucose Mysteries and the calculation workshop and basal bolus therapy in the hospital. Those are all definitely included in the exams. We have that type 2 intensive. But for example, cancer and diabetes, I've never seen a question on cancer and diabetes in the CDCES. In the BC-ADM, yes. So this content is, some of it's designed for certification, some of it's designed for your own knowledge and curiosity. The other thing we have is, I can't wait, we're gonna have our virtual program again in April with Dr. Diana Isaacs, who's really world-renowned for her knowledge of diabetes, pharmacology, technology. She loves diabetes technology. And then Ashley LeBrier, she has just done such a wonderful job of sharing information about nutrition therapy. She speaks for 4 hours on our third day. We have a new program that addresses diabetes distress. So it's a 4-series program where we really tackle diabetes distress, differentiate it from depression, and then we give you some really awesome clinical tools to help you serve people who are struggling and help them get to that other side where they're feeling more empowered. These are our diabetes toolkits that Diana Isaacs is talking about. Technology toolkit. This is a 4CE program. If you want to know more about technology, this is a great place to get started because she has a show and tell she does, and it's so terrific. On the exams, they will cover technology, and you want to be familiar with it. And it's kind of so big right now, technology. This course and listening to Dr. Diana Isaacs will really help you hone in on what's important. And then our test taking toolkit. So I was saying, you want to increase your test taking muscle. This toolkit is over 200 sample test questions on the computer. Well, when I say sample, they're like simulation test questions because I've written most of them, and Dr. Diana Isaacs has written a few too, but I just updated them yesterday so that they match the 2023 ADA standards of care. So now, the standards of care, they update them every year, but it takes about a year for either exam to catch up with the standards, with one exception. If there's a major clinical change, you will see that immediately in the exam. So, for example, in 2023, this year, they updated the blood pressure target. The blood pressure target, or they defined hypertension as a blood pressure 140/90 or greater. But this year in 2023, they've updated it to say a blood pressure of 130 or 80 or greater is defined as hypertension. So that new blood pressure definition of hypertension will appear in 2023. It will appear immediately because it impacts our clinical practice so much and we need to know about it. So that's just one thing to know for either exam in 2023. And like I've mentioned, in our app, we updated it, the standards of care, so you have the most recent version. And our test taking toolkit has the most recent exam questions, so you can be familiar with those with the new standards included. Okay, so just to recap, we have a CDCES Deluxe Prep Bundle, BC-ADM, and the Ultimate Bundle, which includes everything. And I just wanted to share with you on our this is our website. And if you click on, we always highlight a student who's passed their CDCES or BC-ADM, and you can click on that and go to our page of people who have achieved certification. And it's a very inspirational page. People from all different walks of life and different areas throughout our country who have taken the certification exam and succeeded. And it's just very touching to read about their journeys. Oh, here's a few of them. So I just want to thank you so much for joining us today. And every day I show up for work as a diabetes specialist, I do feel like I'm a part of something bigger. You're part of a community that's passionate, and we collectively work together toward improving quality of life for people living with diabetes. Diabetes specialists have this opportunity to make an impact in a variety of settings, from individuals to groups to communities to population health. And we are laser focused on advocating for excellence in diabetes care, coupled with compassion. So I love this wonderful opportunity to share my passion with diabetes care and education with all of you. Keep in touch. We have a lot of different social media venues that we utilize to share the latest content on diabetes and our question of the week and our rationale of the week and updates to our pocket cards, for example. So we really want to share our knowledge with you. You're going to do great, whatever you choose, whichever pathway. We're here to support you along the way. If you have questions, you can email us, you can go to our website, and you can chat with Brianna. You can call us, we pick up the phone. So thank you so much for joining. I'll hang out after class to answer any questions, and know this is recorded. So if you want to listen to it later or share it with somebody, it's available. So appreciate you. Thank you so much. This is Beverly Thomassian signing off.